Similarly, when if it is the clitoris, then the female sex organ is the clitoris. That is everyone knows now. In the similarly, this phallus of ectoderm is in the develop in the form of tube-like penile shaft, like a tube. It's called the penis. Is a male baby. That now, if you clear this much idea, it is a very important that for female orgasm, size of penis has no matter at all. Even size of 2.5 inch to 6 centimeter inch or 7 inch up to the 15 centimeter is a normal size of penile shaft. So don't always give during counseling, say to your patient, don't worry about the size of your penile shaft. You can provide or enjoyment or you can take any lady in orgasmic state by stimulation of clitoris. When your ring finger is sufficient to stimulate or provide the enjoyment to the any partner, any female partner. If this idea is clear, this much is clear, then patient myth and misconception removed that size is not at all so much importance in the orgasm stage of the female partner. Then second things you must remember here, clitoris remain outside of the skin and clitoral stimulation is not done during the intercourse. So the foreplay and clitoral stimulation has a main role for taking the female in orgasmic stage. So foreplay is very important factors because you have to be stimulate clitoris either by your fingers and fingering and other things during the coitus. Secondly, the female get this clitoris outside, it gets still go on stimulating continuously. So orgasm after orgasm is very common in female. A male get erection faster, ejaculated within 10 seconds. That should be more than 1 minute. That is called the quick ejaculation or premature ejaculation. Is very common in a female. 70 to 80% males particularly. 70 to 80% males have the very common premature ejaculation. This premature ejaculation should be controlled by various physical therapy, exercises, and sex therapy like shockwave therapy and local stimulation therapy. Then Kegel's exercise, stop and flow methods you can use in Kegel's exercise. Kegel's exercise is a main role in female pelvic floor exercise, where the female asked to empty the pass the after urination, just contract and relax at the anal area, so that it is also called Ashwini Mudra in yoga, or those who are Ayurvedic they will know Ashwini Mudra, and that everyone should practice it, contract and relaxation minimum 8 to 10 times for 2 to 3 times in a day. This also solve the problem of incontinence of urine, is very common in a female patient. And male stop and flow method can be used, or I said always Master Johnson's stroke therapy. Just whenever he feel after during intercourse he is going to ejaculate, remove the penile shaft completely and again introduce, again remove, again introduce. This is the way what he can give the master strokes. And ask the patient how many strokes during intercourse. He may say 5 times, it is a 2 within a 10 seconds is ejaculated, then you will say it is a 2 times, 3 times, 4 times, like that. Time duration will increase more than 1 minute, and this is a better exercise you can ask every patient. Along with this, you can give the dapagliflozin for not a regular basis, for maximum I'm prescribing for 21 days to 3 weeks or 1 month max. And you can ask the local anesthetic cream to be applied at the glans penis if it is a very sensitive, and get quick ejaculation patient, that is a premature ejaculation patient. Means this is the way you can treat premature ejaculation, erectile dysfunction in male patient, and in female stimulations and relaxation with the incontinence of urination problem, and along with this low libido you can solve with these simple methods. Now, after anatomy, and we applied anatomy and physiology, we will go psychology of sexual response. What do you mean by psychology of sexual response? Most of the psychologists said sexual development in the child started from after the birth of the baby. As the great psychologist and neurophysician Sigmund Freud said, when the baby is 0 to 1 year, he start feeding, breastfeeding. If anything, and then 0 to 1 year, 1.5 year, then 1.5 year to 3 years, anal stage, and so on. If anything happened wrong in these stages, that may cause problem in their adulthood sexual life. Then session 2 we will take next time, and in this session we will complete neural mechanism of sex. We are going to see all the tour so that you can understand what we will cover. Hormones in neural mechanism of sex, sex center in the limbic system near hypothalamus, and local autonomic nervous system, that is parasympathetic and sympathetic at lumbar, that is a T12 and lumbar 1, lumbar 2 segment, and sacral stimulations for parasympathetic nerves. Then hormones in sex, very well, testosterone is the main hormone for the male and estrogen for the female, but all the hormones are secreted up to certain level. We are going to see in our future slides. Sexual problem, male sexual problem are mostly if the young is related to, you divide any problem whenever patient comes to you. Simple way, always see the age of the patient. It may be psychological problem, it may be organic related, it may be due to the vascular cause. So you can rule out this cause very well by history taking. Suppose the patient is around 20 year age, young, then it having a problem about quick ejaculation or premature ejaculation because of anxiety, psychological factors, and so on. If the patient is 40 years having the same problem with erection and with premature ejaculation, it's maybe find out the organic cause like diabetic mellitus and hypertension. Sometimes diabetes mellitus first, sometimes hypertension first, then diabetes, and so on. So you have to treat the underlying disease along with this standard treatment of ED and P. Those are vascular disorder you can find out from the penile Doppler test. If you don't want to go for penile Doppler test, simple stamp test you can advise. Stamp is what? Postal stamp. There is a corrugation between two stamps, and these are the stamps you can roll at the base of the penile shaft at the bedtime, and if it is a turnout or broken down and during night time, that indicate that there is no vascular problem or blood flow is normal. It is a problem due to the psychogenic or other cause pathology. Simple way, you just, I'm explaining in simple way that you can understand the things and you can use this in a practical aspect during your OPD basis. Now, hormone sexual problem is a history taking we are going today, and because history taking is very important. I had a patient. See, what we are going to go ahead and we'll discuss so that it's the better, you will have the better understanding and